down in South Florida for 27 years, private practice together. We're both certified MDT, and, we use McKenzie purely with all of our patients. Orthopedic, most, heavy in spine. Actually, that's all I see. And Gerry will see the extremities. We have enough spine patients to keep me busy full time. We're both full time, and it's just the two of us. And we have somebody at the front desk as well that does everything else.
Yeah, well, it certainly we're a lot slower, but we're practicing the way we normally practice with the additional following CDC guidelines. We're now become obsessive cleaners.
Yes.
We wear our face mask. We're cleaning before and after every patient. We're trying to keep social distance when we can, when we don't need to be right on top of the patient. Sometimes we need to be with the patient, but we're as usual, we're washing our hands before and afterwards, but we're making it very visible that we are washing our hands before and afterwards.
Yeah.
We're wearing a mask.
Yeah, the patients really appreciate that.
Yeah, we want them to be safe. We want to be safe. We're in it all together, so we're just trying to protect people.
Yeah, but we're very, very slow compared to where we are is it's very seasonal, and this hit us right at our usually busiest month of the year, because we have a lot of snowbirds that leave New York and come to Florida for the winter. So that has been a challenge. So we have tried some telehealth as well. But I think that's a question later on, I think.
Yeah, we've been trying to do that more. And when we call a patient and they're not comfortable coming in, we let them know that, listen, the method of practice we use, MDT, is perfectly suited for telehealth. And, the outcomes that we can get are really not a lot different than if the patient was here. There's some slight limitations, but it is probably the most effective method of treatment if you're in front of the patient, but even from a telehealth standpoint, it's by far more effective than other methods via telehealth, because we're promoting self-treatment, and hands-on doesn't have to be, it's not so critical. We've done this in the past before. We've seen a few patients here and there via telehealth, and it's been highly effective. So, we're trying to, educate patients of the same, and, it's getting across to some people, but we're trying. Some people are interested, some people are not.
You can evaluate them, by assessing their range of motion. You don't need to be right in front of them. You and I could assess your neck range of motion right now very easily. You could take a history very easily, and then, the crux of the McKenzie method with what happens to the symptoms with repeated movements, can be done very easily. Actually, you have a patient right now that said he was coming in person and then switched to telehealth, and he made a comment that it's even more effective via telehealth.
Yeah, he did say that. He said that I have to be much more descriptive in my explanations. I can't just show you. And he said that, he feels like he's making more progress via telehealth. So I said, please write a Google review and put that in right away for us. That'd be helpful.
The insurances, very few right now cover telehealth with, with the face and audio back and forth. Medicare, it does not cover it. Blue Cross, at least, does not cover it, at least here. And the insurance, and those are, two big payers of ours. The insurances that are covering it are only covering it up until mid-June. And so that would be a limitation, but we would put, we always have to, tell the patient the importance and the good results of MDT. And a lot of times we have some doctors that refer the patients that really promote us. So the patient is already bought in, so that helps. But I think down here, I mean, we're in an affluent area, but there's still patients that want to use their insurance, and there's some that probably wouldn't even blink an eye.
There are some circumstances where I think telehealth in the future will be very helpful, and an example would be we have a lot of patients that travel, and they may say we have to put physical therapy on hold for a couple of weeks because we're going away, and if we can continue the care while they're away, and not lose them, or I'm living up in New York, I'm coming down for the season, I won't be there for 2 more weeks. We can get started now. If they're in need of therapy now, then that might be, or we're almost done to achieve their goals. They need another 1 or 2 more weeks. We can continue seeing them via telehealth. That would be a great way not to lose that patient and continue the continuity of care.
Yeah, like this has definitely helped us to realize that just because you're not here doesn't mean that therapy has to stop.
Yeah, I think in the beginning it was more like a deer in the headlights. We just were in shock and we don't know what to do. Now we're starting to realize that this is a long-term game plan. Now we've got to continue with this. Even if things were to go great with the virus and cases would go way down, people are still going to be reluctant to go to movie theaters and go to restaurants and go to physical therapy. So we need to promote again to referral sources, to patients, and telehealth has to be an option. I think first of all, I think you need to reach out to your patients. I mean, you have this referral, source of patients that are coming, and some of them are sheltering in place at home, and just to get a friendly voice on the other side of the line saying, hey, we know what you're going through. Is everything okay? We are still open. We can help you. Just showing empathy for their situation, and that there's somebody out there that cares about them. I think that's really important.
Yeah, and MDT is the perfect platform for telehealth.
Yeah, and then also you need to reach out to your physicians. You need to say, listen, we are still open. We do offer telehealth. It's perfect for, Mary said, MDT is perfect for the telehealth platform. So you need to continue to keep those lines of communication open. You can't just freeze and do nothing. You have to be proactive.
There are a lot of clinics that have either, in this area, that have either closed or have gone down to a couple of days a week. I mean, we're seeing maybe 20% of what we normally see, but I think we still think it's important to stay open for those patients that want to come. It's important for us to keep our routine. We still get up at the same time, we shower, get dressed, get in here. We've been playing catch up with some of the stuff that we typically do in the summer, like some of the clerical stuff and paperwork stuff. We're looking for a new software system for our EMR and our billing. We've actually been very busy that way. I mean, we're not busy seeing patients, which is what we would prefer, but I don't think either one of us, I mean, except when we look at our schedule, has felt this that much. Well, that, and then when we go to the grocery store and there's no toilet paper.